college as well. And today for Head Start, I'm going to be talking about mouth rinses and flossing specifically for kids. So when we talk about the different types of flossing, there's a lots of different choices of floss out there. So you're able to see the types of floss that are on the left. Those are going to be handheld flossers, and these are really great. Kids love to use these because they're so easy to hold. We really recommend this is a great way to start kids flossing and to let them do it on their own. Things you want to think about when you're flossing is that these flossers are one-time use. So if you use it one time throughout the mouth, you want to make sure to throw it away when you're done. Another thing to think about is to not have your kids push too hard when they floss between their teeth. Their gums can bleed if they are too hard with flossing. And in your child's mouth, any teeth that touch should be flossed. They can hold bacteria that can cause cavities, and we want to make sure that we're removing that with floss. Ultimately, the best way to floss is the old-fashioned floss that you hold with a string. This can be hard for kids to do, especially young ones under the age of 5. So you really want to try to help them if you can. Parents, you are able to floss your kids' teeth. You just want to make sure that you wash your hands really well before you do so you're not putting any bacteria in their mouth. And if you're flossing multiple kids' teeth, you want to make sure that you're washing your hands in between each kid so that you're keeping all that cavity bacteria in their mouth and not spreading it from one kid to the next. The other thing we'll talk about is mouth rinses. There's lots and lots of mouth rinse out there, but the main thing to focus on is what kind of mouth rinse you're using and when to start. So if you have a child that's under the age of 6, the American Dental Association recommends that they do not use any sort of mouth rinse. Mouth rinse will contain fluoride, which helps us to fight cavities. However, if we swallow a lot of that, it can give you an upset stomach, and it's not anything that we want our young ones to be taking in. So things to consider is that your child has to be able to swish really well with the toothpaste that's in their mouth and spit it all into the sink. And really, it's after the age of 6 that you want to start to implement mouth rinses. Nothing too early than that. And it's okay if you want to start by just giving your child some little sips of water to swish around and to spit with to kind of get any of the plaque off of their teeth. And that's a good way to start with mouth rinses. However, mouth rinses are always in addition to good old-fashioned brushing and flossing. Mouth rinses do not replace anything. So just because you're implementing a mouth rinse doesn't mean it's going to take any of the plaque in between the teeth or on the teeth. So you want to make sure that you're still brushing and flossing because that's our gold standard of care. Mouth rinses can be great if your child suffers from cavities or wants to get some additional fluoride on their teeth. There's some great products out there. Crest, Colgate, Act, Listerine has a lot of anti-cavity mouth rinses for kids that can also dye the teeth a little bit of a color to show any spot that you might be leaving plaque or that food debris behind. Good areas for everybody to practice brushing. And then also there's a lot of anti-cavity items out there and rinses that do not contain fluoride if that's something that you're looking to do. They won't have the American Dental Association seal on them if they do not have any sort of fluoride products in them. However, you always have the option to go for a more natural route if that's what's going to work for you and for your family. Just really making sure that you're brushing and flossing and then incorporating mouth rinses if you're able to. Another thing to think about as well is you always want to make sure for children that you are utilizing an alcohol-free mouth rinse. They should not be using any sort of a product that contains alcohol, which is what a lot of antimicrobial Listerine rinses will have, is that alcohol in them to help remove a lot of bacteria. So be cautious of that and keep your eyes out for different types of mouth rinses for your kiddos. Ultimately, at the end of the day, it's really important that your child sees what you're doing and the type of home care that you're implementing. Ultimately, we are our children's greatest teachers, and anything that they can see you do getting excited about dental care can help to stop those cavities. It's such a thing that we are able to prevent. Dental decay does not need to occur in our kiddos' teeth if we have the tools to help keep cavities away. Things that include brushing, flossing, mouth rinses, and trying to strive for a healthy, balanced diet. And if you're able to get your kiddos in to see the dentist, we like to see kids twice a year for cleanings, exams, and x-rays. And typically that starts at the age of 1 after the first tooth has come in. There's lots of options out there if getting to dental care is a struggle for you. There's affordable options. You can always seek out. February is Dental Health Month for children, and there's lots of programs around for Give Kids a Smile, and it includes free dental care, and you can always utilize that at givekidsasmile.com and search in Minnesota. I have also included some really great websites. Dentalcare.com is an excellent spot that you can utilize different types of products, and it also helps to give you brochures, handouts, pamphlets, multiple languages, and multiple options. In addition, with some links that I'll include for brushing and flossing for kids, a Sesame Street brushing, and then mouth rinse information that was covered today. Thank you so much for your time, and thank you for being part of this video, and good luck with your dental care at home. Thank you so much.